Mr. Chairman,
No, sorry, I got the
come
gavel.
on.
No, I got the gavel, Bernie. This is about cybersecurity. Thank y'all for those who actually talked about cybersecurity.
At a Senate Help Committee hearing on July 9th, Congress convened to discuss healthcare and cybersecurity. But the hearing quickly turned into a repudiation of Trump's one big beautiful bill when Senator Sanders delivered his opening statement.
There's no question but that cybersecurity and protecting the privacy of Americans' healthcare records are important issues that need to be dealt with. But, Mr. Chairman, let me be very clear. That is not the issue that is right now on the minds of the American people. What people are worried about is the catastrophic impact that the reconciliation bill that was passed last week will have on the health and well-being of the American people. And that is the issue I'm going to be focusing on today. That legislation, passed by one vote here in the Senate, will be making the largest cut to Medicaid in American history to pay for the largest tax break for billionaires in American history.
Sanders continued confronting Chairman Cassidy, who is a doctor in the medical field.
It is not rocket science. You're a doctor, you know this. If people don't have access to health care, if they can't get to a doctor when they need to, people will suffer and tens of thousands will die. It happens today. It will only get worse. Make no mistake about it. This bill is a death sentence for working class and low-income Americans.
Cassidy responded by reiterating what the topic of the hearing actually was.
I will take advantage of explaining some of the things in there which are not true, but this hearing is about cybersecurity. And I hope our witnesses will limit their remarks to that. If not, we will suffer through them otherwise.
This hearing is about health care in America, and I hope the witnesses will tell us the truth about what's going on today.
And so, again, to our hearing about cybersecurity, which is an important issue within healthcare of America, I'm here for the whole event, so I'll defer first to my down dais, Dr. Marshall. Oh, testimony, I'm sorry. I got distracted. Mr. Garcia, let me introduce you. I apologize. I'm distracted by the distraction.
Sanders, however, wasn't finished. Two of the witnesses he invited to testify also addressed the dangers of the bill instead of cybersecurity.
As significant a challenge as cybersecurity is, this hearing's objective of securing the future of healthcare is far more seriously threatened by the reconciliation bill that the Congress just passed. As Senator Sanders indicated, and as CBO has stated, that legislation will cost healthcare coverage for 17 million Americans. We know what that means. It means people will be sicker than they need to be. It means they will skip preventative services that they should obtain. It means they will not get treatment when they need it. It means when they do go to get treatment, they will pay more than they should. And it means, ultimately, that many will die needlessly.
In collaboration with the University of Pennsylvania, we recently evaluated the public health ramifications of the reconciliation bill. According to the Congressional Budget Office, as been mentioned, 17 million people are poised to lose their health insurance. We found that as a result, over 51,000 Americans will die unnecessarily every year. Beyond mortality, we estimated the repercussions for the treatment of chronic conditions. We project that with the loss of health care, over 130,000 cases of diabetes will go untreated, along with 101,000 cases of substance use disorders, 165,000 cases of hypertension, and 201,000 cases of mental illness.
When it was Senator Husted's turn, he argued that the bill would be helpful to his state of Ohio and rural hospitals.
I have a letter, Mr. Chairman, I would like to submit for the record from rural hospitals in Ohio talking about how the most recently passed legislation is so helpful to them.
Without objection.
It will increase funding for rural hospitals in Ohio by 24%. Previously, they were receiving 91% of the Medicare rate after the passage of the bill, and by subsequent actions by our partners at the state level, they will be receiving 115% of the Medicare rate.
But Senator Sanders shot back again, challenging Husted's assertions by asking one of his witnesses the impact on rural hospitals in his opinion.
What is your sense about how this legislation will impact rural hospitals throughout the country?
Although I'm from Ohio, I don't know what that reference was, but I think the best evidence is it will be devastating for rural hospitals, and the $50 billion was about a third of what's going to be lost overall for rural hospitals from the bill. I think what you just said is really important. A significant number will close. Others that stay open will massively scale back the services they offer. And as we know, what that means for people in rural America is that they're going to not get access to care. Often the rural hospital is not just one of many hospitals, is the one that they can go to, and the choice is to not go at all. There are also economic linchpins and community centers. We're going to see really the de-atomization of rural America worse as a result of this Medicaid cutback.
The chairman, visibly upset, challenged the claims, calling them half-truths.
Well, among the half-truths being promulgated, the nursing homes are carved out of this legislation, so I'm not sure how they're going to be affected. That said, let's go with some real.
Oh, Mr. Chairman.
No, sorry, I got the gavel. No, I got the gavel, Bernie. This is about cybersecurity. Thank y'all for those who actually talked about cybersecurity. I really appreciate that.
When it was Senator Hassan's turn, she also brought up the dangers of Trump's budget bill.
I want to start by acknowledging the larger threat to our hospitals and the health of our constituents today, which is the threat of the $1 trillion in health care cuts that President Trump signed into law last week. And with respect for the chair, I do want to say that there are provisions in the bill that was signed that will impact nursing homes, including the retroactive coverage provision. Many of our rural hospitals are also going to be impacted in significant ways. They already operate on thin margins, and these cuts to Medicaid and the Affordable Care Act will force many rural providers to the brink of closure.
While cybersecurity was discussed, Senator Cassidy ended the hearing without allowing Sanders to make any closing remarks, which isn't the usual protocol.
For any senator wishing to ask additional questions, questions for the record will be due at 5 p.m. Wednesday, July 23rd. Thanks for being here.
Mr. Chairman,
And,
I ask unanimous consent.
committee stands
Add
adjourned.
Something into the record? No? That's very nice.
Thank you.
For more clips like this, stay tuned to Congress Clips, and thanks for watching.